Good afternoon, and thank you for joining me for the update on COVID-19 here in Erie County. Today we have 13 new cases to report as of 12:01 a.m. for a total of 1,408 cumulative positive cases since March. 77 of those cases are currently active, with 1,284 recovered cases, and to date we've had 24,525 negatives and 47 deaths reported in the NEDS database. Of the cumulative cases in Erie County, 58% are female and 42% are male. Here is the breakdown of the total cases by age. 3% are 0 to 4, 2% are ages 5 to 9, 6% ages 10 to 18, 15% are ages 19 through 24, 37% are ages 25 to 49, 19% ages 50 to 64, and 18% are ages 65 and older. Regarding race and ethnicity of our cumulative cases, 62% are white residents, 22% are African American or Black residents, 7% are Asian, 2% are other, and 7% are unknown. Regarding Hispanic origin, 7% are Hispanic of any race, with 83% non-Hispanic and 10% unknown. The gender and race reports can be found at eriecountypa.gov by clicking on Cases on the COVID-19 page. You will also find the cumulative cases by zone map, which was last updated September 8th. Our positivity rate here in Erie County is 2.5%, which is really very, very good news. We are so proud of our community for following the guidelines and for helping to truly keep our numbers reasonably low. So very well done, Erie County community. Please continue to do your part individually to help stop and slow the spread of COVID-19 in Erie County. I said early on that I believed Erie County can set the example for other counties, not only in Pennsylvania, but across this nation, and how we confront this virus. Our numbers prove that we are on track to do just that. As we approach the fall season, I also encourage you to take another step and get your flu shot. The routine annual influenza vaccination is recommended for all persons 6 months of age or older. Getting a flu shot is especially important this year because influenza season will coincide with the current circulation of the COVID-19 virus, which will likely result in an increase in the number of cases for each of these viruses. Early vaccination can reduce the incidence and severity of illness from influenza. It can also reduce symptoms that might be confused with COVID-19. It takes 2 weeks after receiving your influenza shot for it to become effective. A huge part of what's helping our community keep our numbers low is the cooperation of our businesses. Governor Wolf announced this week that restaurants who complete a self-certification process may increase indoor occupancy to 50% starting on September 21st. Also, alcohol may only be served with the purchase of a meal, and there will still be no bar service. A server needs to bring the drinks to the patron with the meal. In addition, all alcohol sales are to be suspended as of 10 p.m. each day. I'm continuing to count on our business owners for the compliance that's necessary to mitigate the spread of COVID-19. As you can see, with each positive step that you make, we're getting closer to being fully operational in our businesses, and that's a really good thing. So thank you individually, thank you as businesses for being great partners, for being the superheroes in Erie County who are helping to stop the spread of COVID-19. You, along with our Erie County Department of Health, are cooperatively working to keep our numbers low. I'd also like to remind those of you listening who run a nonprofit or who have a small business that the deadline for applying for the Erie County Cares Small Business Assistance Grant Program and Nonprofit Program as well as personal protection equipment for small businesses. The deadlines for those are coming up, with the small business applications due by midnight on Friday, and the nonprofits and personal protection equipment grant applications due at the close of the day on Monday. So this assistance is for small businesses, for our nonprofits, for the tourism businesses in our community, and it's really essential that you apply for this money that will hopefully help your business, your nonprofit, stay afloat until this pandemic is over. So be sure to collect all the required documentation and submit your application before the deadlines, and you will find all the information at Erie County Cares at eriecountypa.gov under Erie County Cares. And now I invite Melissa Lyon, the Director of the Erie County Department of Health, to provide us an update from the Health Department. Melissa?
Thank you, County Executive. I wanted to echo the sentiment that you put forward around everyone really doing a great job in Erie County. The numbers have been incredibly manageable. The positivity rate at 2.5 is also incredibly encouraging. So I just want to make sure that everyone recognizes that we recognize all of the hard work and appreciate it very much. I wanted to touch briefly on the contact tracing that I spoke about 2 weeks ago or so, and how that works from the Erie County Department of Health contact tracing process. I was reminded after that press conference that we have a partner in the community that is also doing contact tracing. They're contracted through the Pennsylvania Department of Health, and that's LECOM Institute for Successful Aging. They have a contract for what we refer to as the Regional Response Health Collaboration Program. They are responsible for over 80 facilities in the region to do contact tracing of the residents that live in those facilities and also the staff that work at those facilities. So if you are a resident of one of the facilities, or you're a staff member, an employee, you may be receiving a call from the LECOM Institute for Successful Aging. They are doing contact tracing on behalf of the State Health Department, and that is in collaboration with the Erie County Department of Health. Schools and universities are also playing a role with contact tracing. Schools have hired or identified pandemic coordinators for their school districts, and universities are typically working with their emergency response coordinators, who are typically responsible for planning emergency response plans. So in those two settings, schools and universities, they're responsible for identifying contacts of known positives and collecting the contact information for those known contacts. However, the Erie County Department of Health is still conducting the initial case investigation, following up a phone call with them, and also doing the contact tracing of the known positives. The reason that this is the process is it's more than just a phone call that instructs an individual to quarantine. We ask a significant number of questions around the individual symptomology, with their household status, are they able to quarantine safely, and do they need any additional resources to help them quarantine during that period. So it is still a little bit more deep diving in the questioning, and so the Erie County Department of Health continues to do that. But as you see, we are developing partnerships with other agencies and entities that are assisting with our efforts. So if you're ever worried and you think that you should not be being contacted, or you're concerned that it's not an appropriate call, don't hesitate to call us at the Erie County Department of Health at 451-6700, and we should be able to confirm for you whether a call should have been made directly to you around contact tracing, quarantine, or isolation. Thank you. That's my update for today. Back to you.
Thank you, Director Lyon. And now we will turn to the media for questions, and we'll start today with Erie News Now. Erie News Now, are you with us?
Hi, I am. Good afternoon. Director Lyon, would you explain a little bit more about the importance of getting a flu shot and just what an important effect that could have going forward this fall?
Sure, thank you. It's so important that everyone that is eligible and able to receive a flu shot do so this year. As public health practitioners, we are still unsure how COVID-19 circulating with influenza is going to impact the community and also our healthcare systems. Again, if you reflect back to the early days of the pandemic, well, the idea was to flatten the curve to make sure our healthcare systems did not become overwhelmed. And here locally, we did a really great job with that. The idea behind an influenza vaccination would be also to prevent those healthcare systems from becoming overwhelmed with influenza cases as well as COVID-19 cases. The clinical best practices I'm not as familiar with. The healthcare systems are truly the leaders on clinical best practice, but during their assessment of sick individuals, one of the questions they will be asking is if you received an influenza vaccination, because that will help them with their diagnoses of your symptoms. So highly important this year for an influenza vaccine, and I can't encourage you enough to do so as soon as it's available to you. Thank you.
Could a really strong flu season really flummox and gunk up the way that we go about tracing and treating people with COVID-19? Could you see more and more people needing to be tested and ending up only having the flu and other problems like that resulting?
Again, the healthcare systems will know what the best clinical practice will be for diagnosing and discerning whether it's influenza or COVID-19. Many of the health systems actually have the ability to do rapid tests of influenza A and influenza B, and therefore it should be able to be done fairly quickly. But if all of us can take the appropriate measures that we have been with social distancing, masking, getting our influenza vaccination, that information will help the healthcare provider make the appropriate decision whether testing needs to be done and what kind of follow-up will be required. I'm hopeful that there will be enough testing supplies that can handle the influx of symptomatic individuals that will need diagnostic testing. But again, it's just one of those particular situations that we're not sure how it's going to impact healthcare systems and our response to COVID-19. So thank you.
Thanks.
Thank you. Jet TV.
Hi, Connie. Executive Scott Bremner. How are you?
Good, Scott. Thanks for joining us.
Hey, I was wondering if you could touch on a little bit about when the state makes changes that affect businesses in Erie County, particularly over this week has been with the restaurant industry and the bar industries and so forth. And I'm sure you're hearing from business owners that say, we need this, we need that, and then the state takes on their actions. How do you kind of draw that line where you say, we believe that this is the right way to go, even though we understand that for individual, particularly small business owners, this might be causing hardships?
I think the first thing I want to say about your question is that I'm very proud of the environmental division at the Erie County Department of Health, who over these 6 months has built great relationships with our businesses, and it's really a partnership. And they already had those partnerships from the, for example, for the restaurant inspections that they do all the time. But I think the relationship has become even stronger, and the businesses are turning to the Department of Health for the guidance and the help as the different guidelines change from the state level. So I want to commend our health department staff who've been going out and working with our businesses. And I know for our businesses, it's challenging. It's been challenging. We have some who haven't made it. We probably will have more businesses who fail. And that is a difficult thing, because where is the balance on this? And that's the tough decision that's being made at the state level. I know I hear from other commissioners, county commissioners, for example, in very, very small counties who feel that they're being dumped in the same bucket with maybe a much larger county, Erie County, and then Allegheny and others who have many more cases of COVID than they have. But what we've done is we've followed the guidelines, and it's worked really well in Erie County. And we've, I think, helped our businesses be viable. But now as we go into the fall, allowing them to open up at 50% will just help them maybe stay viable, as they can't have as much outdoor seating as they could. But the only way they're going to stay open is if all of us do the right thing, wear our masks, stay 6 feet apart, try to stop the spread within the community any more than it currently is happening. And then I think our businesses can stay open. But if it got bad again, we could potentially see more restrictions being put on those businesses. So I guess I just implore the community at large to help those businesses stay open, just as we've been talking about to help our students stay in school. It's really up to us as individuals to be part of that solution. That answer your question, Scott? Thank you.
Yes.
Sure. Erie Times News.
Hi, Kathy. It's David. I want to follow up a little bit on that. A lot of the business owners, some of the ones we came in contact with, were enthused about the capacity going from 25 to 50%, but were discouraged by the 10 o'clock alcohol curfew, as they would call it. Let me get your thoughts on that. What do you think about that particular part of this, and why is the governor insisting on a 10 o'clock alcohol curfew?
So I think a lot of that has to do with where we're seeing some of the increase in numbers, and it's in that younger crowd. Today, I believe out of our 13 cases, eight of them are in the 18 to 24 age group. So we know that those tend to be the age groups that go out later at night. Maybe go to the bar, have some drinks, and I know right now you're supposed to have food with it, but our bars and the individuals kind of skating the edges of those guidelines. So it's a danger when those younger people go out late at night, drink maybe a little too much, become less inhibited, and maybe the mask doesn't stay on as well as it should be, or maybe it's not on at all, and we end up with the spread in our communities. So I think the reasoning behind this is really to try to continue to stop the spread of COVID-19 in what we know are some of the most dangerous places for the spread. And we know that bars are. Most restaurants aren't open past 10 o'clock. I think maybe in the bigger cities you might see that a little differently, but in Erie County, pretty much everybody's eating their dinner by 10 o'clock and moved on, moved home or gone to do whatever else they're going to do that for the evening. So it really is the bar scene that stays open past 10, and that truly has been shown over and over again to be a hot spot for the spread of the virus.
But we do have many of those taverns in town, and have you talked to any of the owners of the bars that do cater to young adults, and what have they told you about their prospects for remaining in business?
So I haven't had any conversations with them in the last 24 hours since this was decided, and I know that that's a difficult piece for them, because even right now, with the limited capacity and the guidelines, it's difficult. These bars are used to large numbers, large amounts of alcohol being purchased. That's where they make all their money, and so I do agree that this is going to be very difficult. But it's probably going to be much, much more difficult if they actually have to completely shutter their establishment for long periods of time if COVID goes on the rise again as we go into the fall. So it is a give and take on this, and I hope that the people will support their local businesses, their local restaurants, their local taverns when they can and when they feel comfortable. Again, everybody has their own comfort level, but it's a very difficult situation. And there's no easy answer, and I guess that's the difficult thing that we as elected officials have to make decisions on.
Thank you.
Sure. Talk Erie?
Yes, hi, Kathy. This is Joel Natale. I have a question for Melissa Lyon. Melissa, do you have any accounting of the percentage of cases that have a bar or restaurant included in the disease investigation as the contact tracers do their job?
Thanks for the question, Joel. I don't have those numbers at my fingertips. I do know that there was discussion at the state level to modify the questionnaire to include that question. Had you frequented a bar? How long had you been there? How many people were with you? Those types of questions. And I don't know if those changes have been made. And if they had been made, it wasn't that long ago, and we don't have a lot of data around it. But I can get back to you with my team, so I'll jot that one down.
Yeah, at one point we had talked about the alcohol consumption basically being a source of people losing their capacity to do the mitigation, maybe being sloppy, if you will. Is that the number one issue that you think? Because this is significant behavior modification that the government's asking for.
Yeah, I do believe the national data that's being collected, and as close as a county of Allegheny had done some really robust investigations around the cause of the spread of the disease in particular populations, and it really was related to alcohol consumption and gatherings. So it is that the gathering around the alcohol consumption that results in that. I think we also had said typically when we are engaged in drinking, we're also socializing and chatting, and sometimes that chatting becomes louder, more robust, and the data also suggests that louder talking, singing, and so forth results in significant spread of droplets and aerosolization of the particles, and therefore we're seeing greater spread. So I don't think it's a local phenomenon. I think it's really one of the activities that we as Americans often engage in, and we do have lots of different celebrations, and many of those celebrations involve some sort of alcohol consumption. So I don't want to say that it's just a particular age group such as university students. We can see this in all kinds of activities, from weddings to Labor Day celebrations. So it is a contributing factor.
Thank you.
Thank you. Erie News Now, back to you.
Hi. Question probably for Director Lyon here. With the couple positive cases now at Harbor Creek, what happens next? Once you have individuals in the school test positive, what's the process from a county perspective?
The process really doesn't change that significantly from the Erie County Department of Health. We do the case investigation. If they are related to a school facility, then we would ask the school facility to assist with identifying contacts and contact information for those individuals if they have not already started that process. So the only thing that really begins to change for us would be sometimes the school may contact us knowing about the known positives before we actually get that information through the laboratory confirmed process using our National Electronic Disease Surveillance, or what we refer to as NED. So we might get that information faster through the school district just because someone self-reported to the school directly. So if you're talking about anything that would typically change, it might be how quickly we get the information, which is a benefit. Having another partner that works with us, which is the school district, again, another benefit. And then third is we would talk about if they needed to do any type of sanitation, depending on if it was an employee or a student, where they were in the building, so deep cleans and things like that. In general, entire buildings are not closed. It's usually sections of buildings that might be closed for cleaning and sanitizing, that type of thing. I hope that answered the question you were asking.
It does. And Director, just a quick follow-up on that. What's your level of concern seeing a case now in a school district? Is there any increased concern on your end seeing a couple crop up there?
So I'll be honest with you, as school districts moved into in-person instruction, I think they did a really fantastic job planning appropriately and doing plans that incorporated hybrid models or remote learning where they could. And as far as the numbers, I'm pleased with how we've been able to start school and have not seen large numbers. So overall, things are going quite well, and I hope that the school districts would be able to echo that same response.
Thank you, Ethan. Jet TV, Scott?
County Executive, are you generally happy with the response that Harrisburg gives to Erie? Do you believe that your voice, that Erie County's voice, is heard in Harrisburg? And if you want to make a case that says, hey, look, we're basically keeping a lid on the numbers, but our businesses are still getting hit pretty good, can you help us out? Do you believe that that's getting heard, or do you have ongoing frustrations about the state kind of doing what it does in the big picture, regardless of whether individual counties are actually should be held as accountable as others?
Well, I think the state is trying to do their part, and I do feel like they're listening to us. I know that I'm sure Director Lyon could talk to this more than myself. They have ongoing conversations with the State Department of Health, from Director Lyon on down to some of her other top-level management, and so there's a regular communication that happens there. It's difficult making these decisions, you know, it's difficult enough on a county-wide level, and I can't imagine how difficult it is on a state level or even on a national level when you're trying to protect the lives of millions of citizens that you ultimately do have responsibility. That's one of government's biggest responsibilities, is protecting the lives of the people that you represent. So it's hard to decide if you're going to carve out certain counties, but I know there's ongoing conversations, and I will say from a county perspective that the County Association of Pennsylvania does take the concerns of all the counties and tries to lobby with the administration, and they have regular calls also with the administration. I was on a call with the group called CCAP, that's the County Association, and today, and they listen to everyone bringing their concerns forward, and they take that as a one group and a loud voice to the governor and his staff. So I just want to say that we all are trying our best to get through this, but I also want to say this is no time to start relaxing. This is no time to start saying, wow, you know, our numbers have been low now for a few weeks, and we can all just sort of breathe easier and not follow all the guidelines. Make no doubt about it that COVID-19 is here in our community, and it's always out there looking for its next host. And you don't want to be that host, and you don't want to be that host and then take that virus to somebody who's very vulnerable, your grandparent, your parent, your sick, or your relative or friend who has diabetes or any of those other underlying conditions. So as good as our numbers are right now, and we feel good about that, we want our kids to be able to stay in school, and we want our businesses to be able to stay open. So that means that we all have to continue to do this. So we can't just relax and go back to pre-COVID life. Not until we have a vaccine, not until we have a way to control this, not only in Erie County, but across our nation. And I think it's also important to remember that there's still a lot of people traveling. I've heard people have been going on vacation to other places. They come back here. Hopefully they're quarantined for 14 days. Not everyone's doing that, but there's obviously a huge opportunity for that virus to come into Erie County in greater numbers with people that are traveling around. So I say all of this as a word of caution to our community. We like our numbers now, but we want them to stay there, and we need your help to stay there.
Thank you.
Sure. Erie Times News?
Yes, Kathy, this question I'd like to hear from both you and from Melissa, if possible. With the 3 to 4 weeks of reduced numbers, has there been any communication between the health department or Kathy, through your office, with school administrators who either do hybrid or do all online, that they would extend to more in-person classes? Have those discussions been held in the last week or so? And if you can, talk to me a little bit about what those discussions have been like.
So I'm going to let Director Lyon address this, because we have a team based out of the health department and public safety on that team who are working directly with those superintendents really on a daily basis. So I'm going to ask her to speak to that if she has any further information.
Thanks for the question, David. As County Executive has mentioned, we've had a team that's been working quite closely with the school districts, and in particular, it's been through the IU5 and then with the superintendents. We've had some large meetings, we've had smaller personal meetings, and so I'll say the communication is continuous back and forth. If they need our assistance, we're there for them. As far as the question around, do we advise when they can expand their in-person instruction, or if they need to scale back and do all remote learning or a hybrid model, we're using the guidance based out of the State Health Department in collaboration with the Pennsylvania Department of Education, and we help the school districts basically interpret that guidance in their particular situation. and the Erie County Department of Health will support those school districts through their decision making. And whether that's with additional data if they need it, additional considerations, looking at particular scenarios that might be unique to that school district, we're here as a resource to help them feel comfortable in the decision that they're making. And I hope that helps answer your question, David.
Let me be a little bit more, Melissa, if I can, specific on it. Is there any reason to expect any changes? If the numbers continue as we've been seeing them, can we expect any changes that you know from your end, from being in your team's communication with the school districts, that we may see, say, a district that is all online go hybrid, or a school district that's doing hybrid go fully in person? You know, in the short future?
There have not been discussions at that level. I think at this point, most of the school districts, from what I can determine based on the communication, we're going to approach this very cautiously. If their current model is working well for them, I would anticipate they're going to stick with that model. If they're going to do a mid-school year change, I would anticipate you could see that after the holidays. That seems to probably make the most sense just logistically as well as long-term decision making. So right now I don't have any school districts that I think on the fly want to switch one way or the other, if that gave you a little more detail.
All right, thank you.
Thank you, David. And I think it's important to remember some of our school districts are just going back this week. As Melissa was saying, I think they all want to see how their model is working, and then, adjust accordingly as they need to. So I commend the schools. They've got a big job right now, keeping everybody safe. So I thank them for the diligence to trying to follow guidelines and keep their students and faculty and administration safe. Talk Erie, Joel.
Yes, Kathy, question for you. With the governor now allowing 50% capacity at the restaurants for inside dining, do you see any reason that there should still continue to be a 25-person limit for inside or 250-person limit outside for high school sports players, coaches, and spectators? It's kind of contradictory, isn't it?
Well, that 25 inside and 250 outside is actually not only just for sports, it's for all events. So if you have a wedding, for example, it's 25 people inside and it's 250 outside. So it's for a meeting that you might be bringing people together. So it's for a multitude of events, not just sports. So I know some people have been hyper focused on the sports, but I think we should think about all of these other things that people want to do and are trying to do. And again, these are all very difficult decisions. I'm not an expert when it comes to the issues that are being dealt with from the State Department of Health and the experts down there who are trying to look at all the data across the Commonwealth and make those decisions. So it's very difficult to second guess. But I am still concerned about some of these sports. Some of these sports really bring these students very, very close in contact with each other, breathing heavy, as we know. I think that's one of the things about sports. You got to remember, just sort of as Director Lyon was talking about, people being in a bar and speaking louder and singing and those type of things. We know that many of these activities are high-risk activities, and sports, particularly some specific sports, are very high risk for our students, and that's a concern I think there. But I can't really make a judgment on that.
But there are those exceptions, like the Carlisle car shows and the Speedway. How does that all factor in?
Because they're not an event. That's a business, so they're allowed to have 50% occupancy, I believe. So I had to ask that same question recently to David George and his staff, trying to remember that myself. There's so many things to remember, right? But it's different for an event versus if you are a business who normally has that activity. For example, Waldemere or Splash Lagoon or, like you said, the Speedway. But look at the event that happened in South Dakota, Sturgis, and the many cases that came out of that huge gathering. That's the concern when you start to bring more and more people together, that you're going to have spread of this virus, and that's what we're all trying to mitigate and stop, is the spread of the virus.
Thanks so much.
Sure. Erie News Now. Do you have a last question?
I do. How big a fear is college students in general, and of course having everybody back over the Labor Day holiday, is there any lingering concern here as we move on from the holiday weekend with all of those younger people back in the area?
Well, I'm hoping that many of them didn't go home. It's best for people to just stay put. Once they got here, many of them were tested negative. I think our universities, our medical school have all done a great job with trying to test their students, get people into quarantine if need be, and really stop any spread. So I'm hoping that many of them didn't go home, but I can't say that they didn't. And I know that's what some of the schools are trying to do, is get their students to come and stay and just be here until they go home, maybe at Thanksgiving time, and they're not coming back until after the holidays. So the holiday time period, whether it be Memorial Day, Easter, all these holidays that we've seen since this pandemic began, we've always seen a bump. It usually comes sometime 5 to 10 days. We start to see maybe a bump. So we'll see what happens. Stay tuned on our numbers as we get towards early next week, and we'll see if there's been a change. But always a concern. So I always say, stay as close to home as you can. Please try not to travel. It is a danger to the community as a whole. Thank you. And Jet TV, do you have any final questions, Scott?
No, I'm good, Executive. Thank you.
Thank you. David, Erie Times News, do you have a final question?
Yes, Kathy, and you've kind of gone into this a couple of times a little bit, but have the folks, and maybe Melissa can answer this as well, have the epidemiologists, have Dr. Nadworny advised you at all? Is there any reason to expect that this downward trend will continue over the next few weeks, or is there just too many other factors? Schools going back in session, the weather becoming colder, or are you getting any advice that, this looks like we will be in this upper single digit, low double digit area for weeks to come?
It sounds like the crystal ball question, which we never can answer because none of us know what this tricky virus is going to do, but I'm going to punt this over to the director of the health department.
Thanks, County Executive, and thank you, David. Again, it is the crystal ball question. To be honest, I don't expect it to last forever. I think that it's just a matter of time before we will see some increases. The good news is we've built in capacity with per diem staffing here at the health department, so do contact tracing and additional case investigations. So we've been in places where the numbers were much higher, and while it was very difficult and hard work, we know we can handle it and we can do the work. We've also, as I've indicated, engaged other partners, such as the school districts being well educated on what needs to happen. The universities are better educated, workplaces, so on and so forth. So there's been enhanced capacity. So I'd love to believe that we will have single digits for perpetuity until the vaccine becomes available, but that's probably not realistic. We will likely see increases, and then we'll have to fight hard again to bring our numbers back down to single digits. I am going to take this opportunity, since you punted it to me, to follow up. I had an employee internally watching the press conference and sent me information that was going to help answer the question about whether the bars and restaurants and establishments were on the questionnaire. And the answer is that they are. And the question is actually, did a patient or spend any time in a business or establishment, such as restaurants, bars, gyms, fitness centers, movie theaters, salons, or barbershops? And then depending on how they answer that question, what the name of that establishment is, where it's located, when they were there, and then we've asked them to describe the setting as far as reducing the measures, reduction for disease transmission, such as was it indoors or outdoors, or face masks being worn, or face coverings being worn by patrons and staff, and is social distancing enforced and followed. So as you can see, we do now collect that information. And I do not have numbers for you, however, on what that looks like for the number of cases that we're seeing, but we are collecting that data now. So I answered that, and then I'll ask back to you, David, if my question was helpful, or my answer was helpful.
It was, Melissa. Just want to follow up quickly on that. I just wanted to ask one last time, out of the 106 that were exposed at that business a few weeks ago, did that ever result in any cases? And have there been any large-scale exposures in the last week or two?
Thank you for asking, because I was hoping someone would. We've had, of the 106, 2 of those ended up having symptoms related to COVID-19 and therefore became probable. And of those 2, there was what we would call secondary transmission into a household. However, out of 106, that's phenomenal. That's excellent. And that will demonstrate that wearing masks, both by the clients and the employees, and following the measures to the best of your ability when you are at facilities where you need to be in close contact with each other, it works. So I wanted to highlight the fact that businesses can operate, follow the guidelines, have the individuals, in this particular case, it was write their name and their contact information down, and we can be successful. So in all honesty, that is a success story that could have resulted in far more numbers and work for the department and the community. So I commend them for the work they did.
And that business is open again?
I don't know that they opened back up, but that was an internal decision based on their ability to staff the facility. We would not have prevented them from opening up.
Thank you, Melissa.
Thank you, Director Lyon, and kudos again to the contact tracers and the entire staff at the Erie County Department of Health, who took what could have been a very difficult situation, which it was, but they had, I would say, a pretty good outcome from that. So thank you. And lastly, but not least, we'll go back to Joel from Talk Erie for the final question.
Yeah, one real quick one for Melissa. Melissa, can you give us a sense, here we are beginning of September, of the ability of our local healthcare providers, the hospitals and so on, to handle the current number of hospitalizations, ventilators, PPE as it's related to COVID-19?
Thank you for the question. Typically, I have a call, I think it's monthly now, with chief medical officers of the health systems in the region, and those particular calls, they've been reporting that they're prepared to handle anything that could happen to them in the fall season. And then informally, I reach out to the health systems leadership periodically as needed, and we always touch base on how things are going at the healthcare facilities, such as the hospitals and so on and so forth. And everything they've reported back is they're in good condition to move into fall. So let's keep working as hard as we are as a community so that they can do their job and not become overwhelmed, and we can all enjoy fall and the upcoming holidays.
Thanks so much.
Thank you, Joel. And I did want to add regarding, because we're talking about businesses and about the CARES Act funding, I just want to remind anyone out there who is an owner of a business or connected to a business about this funding and another one of these opportunities. And this is all grant money. This is not loans. We have had 48 businesses apply for personal protective equipment. So going back to a business that's a high-touch business like a salon, a barber shop, any place, a small doctor's office. They have to be a small business, so they have to be an independent doctor, independent physician, not aligned with the 2 health systems that we have or 3 health systems that we have in our community. But please go on our website and look at that and see if it's a business that you own or you're affiliated with, if you're eligible. We have funds out there available for you to try to make sure that your employees have the protection they need as they're doing their job every day, and we want to be helpful with that. So again, eriecountypa.gov, and look under the Erie County CARES Act funding opportunities. And now for your weekly reminder about the 2020 census. We're only 3 weeks away from the deadline, and the response numbers remain at 72% of the households in Erie County and 64% of those within the city of Erie. Households who have not responded yet to the 2020 census, you should have received an additional paper copy of the questionnaire. It's important that these be postmarked by September 30th in order to be counted prior to the census deadline in the nation. You can also respond online at my2020census.gov or call 844-330-2020. Finally, as always, I ask you to try to stay as close to home as you can. Try to stay 6 feet away from people that you don't live with, and always wear your mask when you're out of your home and away and near other people. If we all do these 3 things, and as well as wash our hands frequently, use good personal hygiene, we will continue, I think, to help slow down the spread of this virus through our community until we do have a vaccine. So in the meantime, until next Wednesday, again, please stay home if you can. Please stay safe. And as always, please stay calm. Thank you.